Dr. Matthew Devine, the medical director at Highland Family Medicine and Accountable Health Partners, is back with us this morning. Doctor, thanks for a few minutes.
Good morning, Mark.
I want to chat with you about vaccination rates during the COVID-19 pandemic. They are down significantly across the country, but we do need to make a distinction here locally as well. What's behind the decrease?
Yeah, so obviously I think with people being in self-isolation and quarantine and being home, there was not a lot of people going to the offices to get their immunizations. And we're particularly talking about children who are the lion's share of those immunizations that we have. Luckily, there's been really a big concerted effort across our area by our primary care pediatric leaders to really make sure that there was a primary care surge plan put in place. And over the last 3 months, there have been weekly meetings to try to make sure that we are reaching out and seeing those kids that need to be, stay up on their care.
All right, let's create a distinction then between the numbers you've seen nationally in terms of the decrease and the numbers locally. Just how big a drop-off are we talking about?
Yeah, so it was reported through the New York Times that rates that are like the diphtheria and tetanus and the measles, mumps, and rubella could have dropped off by as high as 40 to 50% in the month of April. Our rates here have decreased, but they've decreased about 5 to 15% if they have at all. And even prior to COVID, most of our practices were at the 90th percentile nationally already. So like I said, we've actually been able to not decrease as much as other places.
All right, what should parents be thinking about right now? I mean, as we stand here in the first couple of weeks of June, what's the message for folks at home?
So the message is that since the beginning, we've deemed these visits to be essential. We started with the 0 to 2-year-old children and have expanded our way up to then. Now we've actually put in all these safety measures. All these practices are open and they are following these safety measures. And so if your appointment was canceled or you decided not to go during that time, the time is now to get back in and get caught up with those, because we don't want to have these other types of preventable diseases be able to come out in the midst of all the things we're dealing with COVID.
Those well visits, doctor, they are so important to our overall care, aren't they?
They are. And not only do you get your immunizations, you can get your vision, your screening, your development. You check in with parents, the children, adolescents. There's so many important things that can come with those visits. So it's great that we can continue to add them into this as we expand.
And it's great to see a plan in place locally that's helped that decrease not be such a significant drop over the last few months. Doctor, as always, thanks for your time. We appreciate it.
Thank you, Mark.